Hi, everyone. Welcome to the special report from the Washington Post. So much to talk about today regarding coronavirus and our Washington Post coverage. Here are the top stories we're following. There's this $2 trillion stimulus package before Congress, and it's to give Americans, in the words of Senate leadership, emergency relief. Meanwhile, healthcare providers are struggling to provide even basic supplies to their teams that they desperately need. The global death toll has passed 20,000 people. And President Trump is defying health advisors and saying he'd like to see the country opened up and raring to go by Easter. That's just 2.5 weeks away. Well, I'm Libby Casey, and we're glad you can join us. We're here for the next hour or so to talk with some of our leading reporters on the areas of coronavirus coverage they've become experts in just the last couple of weeks. So joining me in just a moment, we'll see Yasmin Abtaleb, who's one of our health policy reporters. We'll also be joined by Paul Kane, who's our senior congressional correspondent. You can see on your screen there as well this idea of what exactly this $1 trillion stimulus deal that Congress has been cooking up and working on will contain. And that's going to be one of our big topics of conversation. Yasmin, thank you so much for joining us. You've been watching President Trump, the comments he's been making, and what his top health advisors are telling him. Can you give us the latest on what the White House is doing, in the last 24 hours to deal with the coronavirus crisis?
So I think you've seen this week the president sort of more vocally itching to get things up and running again, to reopen businesses, to get people back to school, to basically hope that he can get the economy on an upswing before it's too late. And he can get the economy sort of back to where it was in time for his reelection. That's, butting heads with the advice of his health experts and the doctors and his administration who are saying there could be catastrophic results if you prematurely end social distancing measures, and you're going to pay the price. In the long run, it's actually going to be more damaging to your reelection if you prematurely send people back to work and to school. And because the virus will then spread out of control, there will be a crush on the healthcare system. There won't be enough hospital beds or equipment for people to treat the number of cases. And you're going to see a massive spike in cases. I mean, we're nowhere near, lowering the rate of cases. We're actually sort of on the upswing towards the peak, which, depending on which model you look at or which expert you talk to, could be a couple weeks or a couple months away still.
There's this struggle going on between what President Trump says and what top health advisors, not just those who report to President Trump and work for us, the American taxpayers, but who also work at the statewide level, who work for hospitals. There's such a disconnect between what President Trump is saying and what they are urging. So how much weight does President Trump's words carry? What power is it in what President Trump actually says?
I think they carry enormous weight. Millions of people follow him on Twitter. They see his statements from the White House podium every day. And I think, if this is the president of the United States, he has the most up-to-date intelligence on what's going on. He has the most up-to-date information. He's got all the top experts at his fingertips. I think for many people across the country, especially the people who support him, if he says it's not a big deal, the cure can't be worse than the treatment, it's time to get back to work, a lot of people are going to take that seriously. And we've seen the weight that his words carry, because we know that in many parts of the country, people are not taking this nearly as seriously as they should be. There are images of people still going to beaches, still crowding. It's a little bit less so now, but it is still happening. And I think if you hear the president saying, this is not a big deal, it's time to get the economy up and running, a lot of people are going to take that to heart. I mean, a lot of people are really hurting, being away from work, especially if they're an hourly worker and not still getting their paycheck. I'm sure there are many people who are eager for all of this to end.
I mean, Yasmin, it's like wishful thinking, right? Like we all want this to end. And this is hard on so many people, not just in America, but around the world. But all the experts are saying the faster we follow the guidance, the health officials' guidance to stay in our homes, to avoid contact as much as possible, allow those people who aren't necessary to society functioning to get out, whether they're healthcare workers or whether they're bus drivers, allow them to be the ones to move around, and the rest of us try to stay in our homes as much as possible. Why is it so hard for the White House to get on the same page with that message?
Well, I think the thing to keep in mind with the White House, for President Trump, for many of his advisors, his reelection is only a few months away. And the economy was such a strong talking point. It was the key talking point for his reelection campaign, the strength of the economy, the low unemployment numbers, the low jobless rate. All of these things were so key to the president's reelection. And all of that has been wiped away by this crisis. And I think the very difficult thing about this for the president is much of this is outside of his control. And we sort of know he generally feels like he's in control and can sort of move things the way he wants to. You can't do that here. This pandemic is outside of anyone's control. But they're focused on reelection, and we've talked to some people who have said the president views each day this goes on as another day wasted towards his reelection. So that is the mindset of many of the people in his administration, and his economic advisors and business executives who he's had longtime relationships with are saying enough is enough. Like we've got to get things up and running again.
Yes, I mean, we're looking at a map. You can see it on your screen of cases. New York has become such a hotspot. Can you talk to us about what's happening in New York?
So I think Governor Cuomo said right now the number of cases is doubling about every 3 days. And from the podium yesterday, White House advisors said that anyone who leaves New York should be in a 14-day quarantine because it's emerged as the country's biggest hotspot. I think the last I looked today was at 25,000 cases. I'm sure it'll be much higher than that by the end of the day or by tomorrow. And the other thing going on in New York is Governor Cuomo has been very outspoken about the need for ventilators. He's been critical of the White House and of the Trump administration for being too slow to get them the equipment that they need, not the healthcare workers not having enough protective equipment. He sort of put out pleas on Twitter for retired healthcare workers to come out of retirement and be part of a reserve force. He's made very clear the sort of desperate situation in New York because he feels like the federal government is just not acting fast enough and taking matters into his own hands.
As we look at that map, what other parts of the country are you watching? Some of this, of course, has to do with population density, but there are interesting pockets of outbreaks happening. Tell us about it.
So California is another big pocket. Santa Clara and the San Francisco Bay Area. You see sort of a lockdown going on in California. The governor, maybe about a week ago, ordered a lockdown. Pretty much not leaving except for groceries and pharmacies, going to the pharmacy and things like that. Washington State, Seattle is obviously a big hotspot, and it was sort of the first one. You've seen a number of outbreaks at nursing homes across Washington State, which is, of course, extremely concerning because that is among the highest risk group of people. And experts are sort of saying every major city is maybe about 2 or 3 weeks behind New York in terms of cases. DC, Philadelphia, I think there are projections that the South is going to be hit particularly hard. The whole country is going to be hit, but I think especially cities with high population density are most at risk. And the sort of caution is if we're not careful, if we don't take these drastic measures now, every major city or every sort of city is going to end up like New York.
We have a question that came in from Teresa, and Teresa's in Massachusetts. She wrote in and asked us, Yasmin, about the Defense Production Act. And she's asking specifically, would this be effective to produce vital medical supplies, most notably ventilators? And she points out that President Trump has talked about it, but we don't see action as far as I know. Please update us.
Well, we haven't seen it invoked yet. The president, when he signed that into law, basically said it's there in case we need it, but hopefully we never need it. And I've spoken to experts who are saying, why isn't it being invoked? We're hearing these sort of desperate pleas from healthcare workers about having to reuse masks, about not being able to get enough equipment and having to work in unsafe conditions. A lot of them have equated it to going to war without armory or without, sort of proper equipment. There are a lot of questions from healthcare experts and healthcare workers as to why this has not been invoked to ramp up the number of ventilators, the amount of protective equipment. I'm honestly, I don't think we really know what the hesitation is in the administration, whether it's not wanting to be viewed as not having a handle on the situation or if there's something else going on. I honestly don't know, but I do know that people are clamoring for this to be used, saying, we sort of see these desperate stories on Twitter. My inbox gets flooded with them. I know that my colleagues' inboxes get flooded with them. So we don't quite know what the hesitation is.
So let's talk about some of the decision making that's happening at the federal level. We've seen the Centers for Disease Control and Prevention be less visible at these White House briefings. There's a question of the role of Anthony Fauci. He has been looked to nationally as someone who's given clear-cut advice and spoken with authority about what we should all be doing, what we can be expecting. We've seen less of him recently. So talk us through the coronavirus task force. Who is leading the charge, and what role are various people playing?
So the official head of the task force is Vice President Mike Pence. And then you've got representatives from several agencies around the country. And the sort of recent change is that FEMA is the logistics coordinator and running the response, in terms of supplies, making sure states get the resources they need, all the sort of difficult parts of coordinating this response. Dr. Fauci is, emerged as sort of a spokesperson for this crisis. He's willing to sort of gently correct the president when he misspeaks in meetings, that are televised or public or on the White House podium, to make sure people aren't getting misinformation or sort of false hope about when a vaccine will be available or how well a drug might work, or those sorts of things. Our understanding is he's still well respected by the president. The president also respects Dr. Birx, but there is this sort of tug of war going on in that they're telling him, the president thinks he doesn't really want to hear. There isn't a lot of good news related to coronavirus right now. We're sort of in the thick of it. Things are still getting worse right now. We're not at the point where things are getting better. And the economic advisors and business executives are telling the president things that are more in line with his instincts and what he wants to do.
So tell us more about Birx, like who she is and what her role is, why she's significant at this moment.
So she's the White House response coordinator. The way she's sort of been described as Pence's right hand. She has moved into the vice president's office for this response. She acts as a sort of advisor. She's a doctor. She is well respected by both Democrats and Republicans. I think her addition to this response was highly welcomed by everyone. She's viewed as a pro, as an expert. I think in general, people find her sort of presence on the stage very calming. She's sort of making sure that Americans hear what they need to do, understand the importance of social distancing, how respiratory diseases work. And our understanding is, she has shown the president some models. She's ordered models to be made so that she can show the president what the country could look like, how bad it could get. Our understanding is that helped the president take it a bit more seriously, among other factors. And she basically, I'm trying to think of the best way to describe her. She makes sure that the medical view and the public health expertise is very much part of the discussions and the decision making, as does Dr. Fauci, as does Dr. Redfield of the CDC, to make sure that view is sort of prominent. And then it's up to the president to weigh the input he gets from economic people, from business people, from public health experts, and decide how he wants to balance all that.
It's seeming like she's doing some gymnastics here at not directly contradicting the president when they're at events or when they're speaking together. It's like when he throws a question to her that she doesn't want to field, she just sort of blows past it. If she's offering directly contradictory advice to what the president is saying, she's not making a big deal out of it. She's not pushing back on him in a way that sort of points the big arrow or the big finger at him.
Yeah, I mean, she's a diplomat, so she is highly skilled in sort of interpersonal relationships. She's the president has tried to get her to answer politically charged questions a couple of times, and she very deftly sort of doesn't take the bait on it and moves on and explains to people what a respiratory disease looks like or what you should do. You're right that she doesn't directly contradict him. She doesn't jump in and correct him or anything like that. I think her focus is, when she speaks, making sure the information that she thinks is vital for people to get out there gets out.
Yasmin, let's bring in Paul Kane, our senior congressional correspondent. Paul, I know we've got kind of a loose connection, so we can't see you, but we can hear you. Can you hear us okay? Let's see if Paul can hear us okay. Paul, you might be muted, so we're going to try to bring you in here. Well, I know Paul can hear us, so as soon as we get his audio working, we'll bring him into the conversation. And we're so eager to talk to him, of course, Yasmin, because of this giant stimulus package that congressional leaders are hoping is a bit of a lifeline for the American public. How is President Trump looking to Congress to move? Like, what does the White House want out of congressional action?
They want to make sure that any congressional deal has some relief for businesses who are being hurt by this, both big and small businesses. Obviously, there are a lot of American workers who are missing paychecks, and really hurting financially because of this. Democrats have pushed for provisions like paid sick leave and to make sure people aren't that hourly workers and people who maybe have fewer protections aren't punished for having to stay home during this to protect themselves and their families and their communities. And so we know that there's a provision in there to send money directly to Americans to help them sort of get through this time period. There's relief for businesses that are being especially hurt. I don't know the details of the bill quite the way Paul will, but the White House was looking for a congressional deal that would help provide relief to businesses and to people who are being especially hard hit by this.
Let's try again. Paul, can you hear us?
I can hear you. Can you guys hear me?
I can finally hear you. It's so great to talk with you, Paul. We know how busy you are right now running around Capitol Hill. First of all, tell us, where are we catching you? Where are you right now?
I am up on the third floor of the Capitol on the Senate side, right near the Minority Whip office of Dick Durbin, and a little cubbyhole called the Children's Gallery, where if there was normal times and there were lots of tourists here, that's where you take your baby, if you crying baby, to make sure that they don't disrupt Senate activities. But obviously these are not normal times, and there are no public in the galleries. So we're just sort of here now waiting out what will happen, hopefully in the next few hours, in terms of getting to a vote on this massive legislation.
All right, so where are things at? We'll talk through the exact details of the package, but first, what's going on? It looked like they had a deal late last night, so where's the process?
They do. They still have a deal, and they're still reviewing line by line every bit of legislation to make sure that it works, that it says what they want it to say. There were some Senate Republicans were a little bit ticked off at the sort of phase 2, as we called it, that was negotiated between House Speaker Pelosi and Treasury Secretary Mnuchin. They thought there was stuff in there that they didn't really support. So they're going through this with a fine-tooth comb. And in that process, they're coming up with little things here or there that are irksome to each side. There's a fight over whether or not any of these funds could help Planned Parenthood avoid a sort of catastrophic implosion, which gets to the abortion issue, which gets to Hyde language of the old-time Henry Hyde, conservative Republican, who was the one who forbid federal funds going to provide abortions. And so these are the sort of fights that, well, frankly, they're used to having. They have this fight every year or two for 40 years now. So they will figure that out. But the biggest ticket items in all this are pretty much addressed. They know what's going to happen. There's a 4-part package, and 99 point some odd % of that is already locked down, but they just need to keep reviewing it because when they leave here, when they finish this up and it passes the House tomorrow, they're not sure when they're coming back. And so they really need this thing to be locked down pretty tightly. And I still think we're on target for some time later today, possibly in the nighttime, and then the House trying to wiggle their way through some hoops over there to try and pass it sometime tomorrow.
All right, so let's talk about the meat of this, a $2 trillion stimulus package.
Yeah, so the way to think of it is it's in 4 parts, not necessarily in order of importance, but just in the order of the way I think of it. The first part is a small business grant program, mostly direct grants, totaling about $377 billion. That's small businesses, bars, restaurants, retail, storefront retail, that they could tap for grants that would come from banks, that would be backed by the SBA, that are just pure cash into a small business. If you are using that money to keep paying your workers, to keep paying your rent or your mortgage on your storefront in order to keep people employed. Usually the SBA in hurricanes and natural disasters is coming up with loan programs. This is just a pure grant program, pure cash. And it will help every possible bar, restaurant, storefront, the places that really make up the civic culture of neighborhoods. This program could help them. The second thing was partly controversial. It's for bigger corporations. There's a $500 billion fund that is a mix of loans, some grants, that became controversial because it's where airlines are going to get at least $50 billion to try to stay afloat. Other distressed industries can come in for a mix of loans and grants. And, that is where Democrats were fighting to get some more stringent controls put on that money because of their wariness following the 2008 Wall Street bailout, that you saw corporate executives within a year to 2 years paying themselves tens of billions of dollars in bonuses. So then you get to, that's part two. Part three is a healthcare infusion. There is just $130 billion that goes towards hospitals and trying to get masks and like to them. I mean, that is a just incredibly important thing, from anything from ventilators to beds, to anything that can really just help people deal with the healthcare crisis itself. And another portion of this is unemployment insurance. There's been a dramatic uptick in unemployment insurance, that for 4 months, people on unemployment insurance will get an extra $600 in their paycheck. That's become a little controversial because there are some conservatives who now say that they've made the program too big, that there will actually be people that would make more money off of unemployment than they would if it were actually keeping their jobs, and that it's sort of a perverse disinclination toward keeping people on the payroll. But the reality is that's not going to block the entire bill. That's just sort of a sticking point for now.
I want to just mention this carve out that's been done for Boeing, which has gotten a lot of controversy. Now, it's important to point out there are 2 Democratic senators for Washington State, right? So it's not just Republicans who are interested in helping out. Talk to us about that.
I'm the Boeing part, I'm not like 198% locked down on. But as you said, look, it's not a time really where you can start building planes, and Boeing and other plane I'm good, don't worry. Other plane manufacturers are just getting crushed right now, and they don't know what they can do to try to make it through this. And look, Patty Murray and Maria Cantwell know that Boeing is a critical manufacturer up in the Pacific Northwest and the Seattle area in particular, and they just have to try to keep Boeing afloat. But Boeing is a massive, Fortune 50, Fortune 100 company with executives that have been making tens of millions of dollars. They do not have a lot of goodwill among even a lot of populist Republicans, let alone the Democratic Party.
Paul, we have a question that came in from Anita, who's writing from, she's writing in from Bowie, Maryland, and she asked, how much of a direct payment can a head of household expect? So talk to us about what people might be seeing.
Yeah, there's the direct cash payment. I actually, that was really the fourth piece. I went into unemployment. The fourth piece is really the direct cash payment allotment of this. And to some ways, it's going to be the thing that Americans most directly see. Everybody making about $75,000 to $80,000 and under are going to get a $1,200 check sent to them, plus several $100s more for each dependent that they have, each child. So you're looking at families that can be receiving several $1,000s in just a direct check from the government. This is meant to be, in a lot of ways, a bridge towards unemployment benefits for a lot of people, because there were Republicans that actually said, Lindsey Graham actually is one of those who said it makes more sense to run all this through the unemployment insurance program. But he actually, he realized after a couple of days and listening to people like Labor Secretary Scalia that the unemployment programs in many of these states is just not built to maintain the surge of unemployment claims coming in. Nationally, they're talking about 200,000 or so a week or a month, and they're looking at a couple million a week right now. So they're going to send direct checks to people There's a lot of direct deposit information that the IRS already has for a lot of folks, and you might get an absolute direct check sent to you into your account. Others will get them through the mail, and that will be sometime in April. The Treasury Secretary's initial ask was, I think, to send out those checks on April 6th. I don't know if they'll be able to meet that marker, because the bill is going to be passed probably a good 4 days after he really wanted the legislation passed. So, but I think by mid-April, rather than filing your taxes, a lot of Americans are just going to be getting a check in the mail or directly deposited from the from.
I want to bring Yasmeen into the conversation. Yasmeen, initially, Stephen Mnuchin and others were calling for a payroll tax holiday, but Mnuchin warned that unemployment could rise to 20%, and that would be the biggest unemployment since the Great Depression. So how did the White House evolve on this question of a payroll tax cut? How would that be different than what Congress is actually putting forward?
I actually think that's a much better question for Paul. I don't know the specifics of that one too much.
No,
Paul,
sure.
over to you.
Yeah. Look, the payroll tax holiday made sense if you were on a payroll, and if you were, what a lot of people, when you used to get a paper paycheck and you used to look at the actual check, and you'd wonder who this Mr. FICO was, who was taking like 12% or so of your paycheck away. That would make sense, yes, if as a way to inject money into the economy, but not in a way that, all those people who are unemployed not getting a paycheck anymore, giving them a payroll tax holiday doesn't do them any good. Plus, the payroll tax holiday makes a sort of economic sense if you compound it over 52 weeks and you're talking about a 10-12% increase in take-home pay over 52 weeks, and you average that out, and sounds good and all, but reality, week by week, for most Americans, it would only be about 40 or 50 bucks, if that, and that's not really much to help somebody in absolute times of crisis like we're in now. Those that are able to keep their job are now trying to figure out what to do about their lost childcare because their nanny or their babysitter has is sheltering at home, and all of a sudden you're dealing with all sorts of additional costs. And again, that doesn't account for all of the millions of people who are just straight up unemployed and would receive no benefit from a payroll tax holiday.
Paul, we have a question in from Barb, who wrote to us on YouTube, and she asked this: after we get past the apex and do start to recover, how does the nation pay down the enormous debt?
Oh boy.
What are we looking at in terms of where we go with this? Paul, solve all our problems while you're with us.
Oh my God. It's roughly 23 trillion in debt of recently, most recent estimates. And, this bill that Congress is passing is $2 trillion. There's no financing for it. There's no pay for. You're pretty much instantly mathematically jumping to 25 trillion. So, when do we get around to that? I don't know. I think we're looking at the difference, though, between, life and death economically. And it's, to completely go to 25% unemployment would be a Great Depression. And a Great Depression is something that is, it is something that could, wreak havoc for decades, to come. So this is some effort to try to avoid that. And, to not do this, to not take these steps would run up the federal debt anyway, because everybody would lose their job and nobody would be paying any taxes and the revenue wouldn't be coming in. So this is some attempt to try to keep people getting paid, paying their mortgage, paying their rent, paying their bills, and staying afloat. And once we get to the other side, we don't know where that is. If you've ever been out in a boat and you're a little bit worried about how much oil you got, how much energy you got to get you ashore, the worst thing is to look and not know where the shoreline is. Not being able to see it visually is pretty scary. That's where we are right now. We are trying to keep this boat going in the right direction. We're going to eventually, hopefully, see a shoreline. And when we get there, the red ink is going to be brutal. But both Democrats and Republicans have said uniformly, there's no one in Congress right now that is saying we can't do this because of the federal debt. They are all saying, this is life or death for the American economy, and we have to do it.
Paul Kane, we're listening to Paul. Paul, stay with us on the line for a moment. I want to bring James Hohman into the conversation, national political correspondent. Hi, James. It's so great to have you here. Before we let Paul go, because I want you to respond to this afterwards, James. Paul, okay, so Rand Paul tested positive for COVID-19 earlier this week. A lot of people were really upset because he'd been going about his daily life, even if he was waiting for the test results to come back. So tell us the latest on how senators are protecting themselves, what their concerns are about the spread of the virus, and also, PK, you must want to get out of the Capitol too. I mean, as soon as they get their work done, presumably you can start working from home as well.
Yeah, look, all of us as reporters up here, the number of reporters who are still here in the building has dramatically shrunk, just dramatically. We were in the single digits last evening when I left and passed it off to Mike DeBonis, our colleague, who was here till 1:30 or 2 o'clock in the morning until they announced the deal. There are fewer and fewer of us here, and there are fewer and fewer rank and file senators that are really physically here also. Unless they're directly involved in these negotiations, they haven't been around. A lot of them are at their places of residence in Washington, waiting to get the call to come back and vote. And when they do, they'll have a very long vote, a very long roll call, so that only a few senators at a time will even walk onto the floor and cast their vote. The one time where there was a real social distancing problem was Monday afternoon, when Democrats blocked a procedural vote on the Republican stimulus plan, and the place really blew up. Our colleague from PBS, Lisa Desjardins, was in the gallery, the press gallery above, playing pool reporter for all of the few of us that were here. And she said at one point there were 13 Republican senators sort of bunched up on their side of the aisle. That's breaking the 10 or fewer CDC guidelines. Susan Collins walked up to Chuck Schumer and was about a foot apart and was just pointing her finger at him. And that was really a sign of the tension that is going on among senators. They are racing two different clocks right now. They are racing the Wall Street financial global market clock. They are trying to get all of this done so that global markets know that America is standing behind the economy. But they're racing a different clock. They're racing a deadly clock that they can't see, and that's the coronavirus. It's here. It's in the building. Rand Paul has tested positive. 2 House members tested positive. Multiple staff have tested positive. And everybody is a little bit freaked out about their own mortality right now. Mitt Romney, early last week, people were talking to him about whether he felt safe here. And he told reporters that his biggest personal concern was coming down with this virus because his wife, Ann, has MS. And he, if he were to test positive, cannot be around her. Well, Mitt Romney sat next to Rand Paul on Thursday at a lunch that Republicans held, had a conversation with him again on Friday, and he is now self-quarantined himself back home in Utah, where he's not, he's in communication with his wife, but he's not able to see her. They're not able to go through this together because she is both over 60 and has this pre-existing condition that would open her up to, the worst circumstances of COVID-19. So these two clocks that are happening in the Senate right now are both fearful, both panic-ridden, and it's changed a lot about the way people go about their business.
Thanks so much, Paul. And I do want to point out that Mitt Romney just tweeted a little while ago that he has tested negative for COVID-19. So that
great.
Was a relief, I think, to everyone who's been watching that situation. So Paul, thank you. We're going to let you go. Thank you for working so hard. James, welcome to the conversation. Yasmin, we're going to let you go in a moment as well. I want to thank you so much, Yasmin, for hanging in there. James, just quickly before we turn to Yasmin for final thoughts from her, this situation, in the Capitol, it's representative of how hard it is for people, unless they're truly sheltered in their home, And even if they are in that case, how hard it is to really social distance, and the fact that the lawmakers are still interacting with each other and trying to get things done. I mean, all of us can both relate to that and yet be, distressed and worried about it.
Yeah, Libby, absolutely. You're completely correct. And it really is a reflection of the legislative process. You've obviously spent a lot of time on the Hill, and you understand kind of how these things develop and these conversations happen. Chuck Schumer said a few hours ago that Stephen Mnuchin and Eric Ueland, the White House legislative director, have spent more time sitting with him in his office than they care to admit. And, they were trying to sit apart on their couches a few feet apart, but you're still kind of in this hotbed of contagion. Obviously, we know, at least 3 members of Congress have tested positive. Tons of people go through that building. And that's, part of the legislative kind of the Capitol it's the people's house. And so tons of people have come through for constituent meetings and everything else. And so that's, the way, one of the big debates that's been happening on the Hill this week is related to remote voting. And we still don't know how the House is going to end up dealing with this package, whether it'll be a voice vote. It seems unlikely that it will be unanimous consent because there are a few people who seem like they're going to object. But one of the reasons a lot of the old timer Congress members are against remote voting is that it sort of does go against the tradition of legislating and horse trading and people kind of haggling and talking with one another on the floor and working out these deals. And one of the things, I've talked to a few institutionalists today for a piece I'm writing tomorrow about how, the more and more kind of, as Paul was mentioning a minute ago, most rank and file senators weren't involved in these negotiations at all. If your name wasn't Chuck Schumer or Mitch McConnell, in a lot of cases over the last 7 days, you were out of the loop, except for that one instance on the floor where everything sort of blew up that Paul mentioned, where there were 12 Republican senators together. And that is a big change. Obviously, this is a moment of crisis, but a $2 trillion stimulus bill is one of the biggest things. It's certainly the biggest thing of its kind, but it's one of the biggest bills Congress has ever passed ever. And a handful of members and staffers are in the driver's seat, and most members are, because they're not here, because of the way that the Congress has changed, they're out of the loop. And I think that is a real break with tradition. It's where we've been headed, and it's I think this accelerates it, but it is a significant change, and it changes kind of how the legislation ends up working, and who has power and who's empowered and represented, et cetera, et cetera, et cetera.
Yasmeen, before we let you go, I just want to bring you into the conversation real quick, because you were part of this team that did this really important story about how the Trump administration is scrambling to offer guidance to hospitals on what they do if they run out of basic supplies. And this gets to the heart of where so much anxiety is. And while we're all trying to social distance so that it can spread out, flatten that curve so that there isn't a flood of people who need that vital hospital gear. Can you take us through your reporting on that, please?
Sure. So, we know that we've been hearing all these sort of horrifying stories from healthcare workers about how they have to reuse masks, they don't have equipment. Some people who are conducting are not wearing equipment because, they need to conserve it for the sort of highest risk situations, whether it's surgeries or people on ventilators or whatever it may be. So we had heard that the administration was basically re-upping guidance that they had since November 2019 about what hospitals should do if they completely run out of protective equipment, and that they were basically dusting off that guidance, making sure they had guidance for how the CDC has some stuff on its website about how you can conserve protective equipment and make it last longer. But then we found out that they were re-upping and dusting off and updating this guidance about what to do if you completely run out of equipment, which of course is, not something that a developed nation like the US sort of thinks you usually need to think about. I think it's a bit of a reflection of not purchasing equipment earlier in the process when there was time to prepare, to make sure that there was enough protective equipment for when we got to this point in the outbreak. And of course, is a very worrying sign that hospitals are not that far from that type of situation.
All right, Yasmeen, thank you so much. We're going to let you go and get back to reporting. We really appreciate your time. And as we say goodbye to Yasmeen, James, let's talk about that a little bit, because, there is such a question about why the nation's not more prepared for this, and where these resources are going to come from.
Absolutely. And we still don't know. I mean, the president still hasn't fully invoked his powers under the Defense Production Act. He said yesterday that he doesn't think he needs to because companies are voluntarily offering to produce these materials. But we're hearing every hour from governors and hospital executives who are saying there's scrambling for supplies, there's limited numbers of personal protective equipment that they need. Then you have these. There was a company yesterday in Texas that had a private auction where bottles of Purell were auctioning for $40 that were selling for $2 before this, and masks are just priced up 10, 20 times what they normally would cost. And so that's a continuing failure of the federal government to step up and help kind of say who's going to be at the front of the line to make sure that a state like New York that's a hotspot gets what it needs, and maybe some of the lower priority places that aren't spiking are going to be next in line, and no one's doing that kind of coordination. So obviously we can talk about the mistakes and the balls that were dropped over the last couple of years, and we could talk for the full hour about that. But there are sort of things that the administration could be doing right now that they're still not doing, that they're hesitating to do. And the president is, as we saw yesterday, trying to continue to point the finger at Andrew Cuomo and others.
I want to bring William Wan into our conversation, national correspondent covering health and science. William, it's so good to have you with us. You're on with me and James, and so we can kind of have a rolling conversation here. We'll get to some viewer questions. If you do have questions for my guests, you can put them into chat and YouTube. We also have a submission form on the Washington Post homepage. William, you had this vital question that you asked in an article about how long is this going to last? And we're seeing a lot of questions come in on that, just how long people expect for this to last. So what are the factors we should all weigh and think about as we ask ourselves that question?
There's a few things at play. I mean, that's the big question. There's a few things at play. Like, one is how competent we are in terms of the short term. We could see a break in just all these restrictions that we're having to live under. If we get this under control, you can start easing some of those. So that's one. Another really big question is seasonality. Is this going to wane with the weather like flu does, with some of these other viruses does? No one knows. A lot of people studying this, but even those scientists say until we get to that actual season, until summer starts, no one knows what's going to happen with that. There's a few scenarios too. One way this could play out is the endemic route. This just becomes widespread. Like, you may remember a few years ago with H1N1, the swine flu, there was a lot of panic about that. Justifiably so. It turned out to be less fatal than we thought. But in the end, H1N1 is just everywhere now. It's just part of our daily life. The vaccine for it is kind of packaged in part of our flu shots every year. So that's one quite likely route that this could go. And so everyone's just waiting for the vaccine. It's a waiting game if that's really the case.
We have a question that came in from Chris, who wrote in from Silver Spring, Maryland, and asked, why close schools for the rest of the year in states like Virginia? The end of the school is still 2+ months away. A lot can change by then. Governors, localities are wrestling with these questions. So James, let's start with you. First of all, how are governors and localities wrestling with these questions of just what choices to make?
It's all about trade-offs, Libby. They've got to weigh, taking kids out of school creates challenges for poorer families where all of a sudden you have to have childcare. Maybe you're taking kids out of school and you're sending them to be taken care of by their grandparents, but the grandparents are vulnerable to the coronavirus. And so, that's one of the reasons you saw a lot of school systems hesitate to do this until we sort of saw everyone follow, because no superintendent wants to be the person who sort of has blood on their hands because they were keeping every kid in school. And now, when you really do the modeling, you do sort of have to make decisions about the rest of the school year. It's now March 25th. In some places it's 2 more months, and you kind of when you're realistic about it, you realize there's not there's not really a way that the curve is going to be flattened enough that there's not going to be another kind of spike upward. Historically, when you look at past pandemics like the Spanish flu from 1918, there were 3 different waves. And so you kind of flatten the first curve, and then there's a second curve. And so I think the school systems, the governors in many cases that are making these decisions are studying that history and they're talking to the epidemiologists who are all urging them to err on the side of caution. And they're not as worried about the economy. They're worried about the well-being of not just their students, but also their teachers.
William, our Chris, who wrote in, also asked, like, what if things change by the end of May or by the start of May even? Could we see people starting to go back to school? Could we see some changes in policy?
Yeah, it's a very understandable question. I would be asking it as well. I'm a parent of 2 young kids. It's not easy right now, but
you might have seen one of my little heads run into the here a little while ago.
I've banned them from this room. So if they break that ban, you might see them pop on. I mean, it's a justifiable question, very understandable. But I think the question, also speaks to the fact that I think we're all still adjusting to reality. Because if you talk to epidemiologists, it's a little bit frustrating in that they're talking about, well, 2 months away, things could change. We're at the very, very beginning of this, and the curve is just straight up. It's so exponentially steep. And so, one biostatistician I talked to, she had this really great quote. I was asking her, well, what about these types of questions? Like, we don't know what's going to happen. Things could change. She said, this is kind of like asking, your house is on fire, and you're asking the fireman, like, when can I move back in? He's like trying his best to put it out still. And so it's kind of like, that's the situation we're in. It's going to get really, really serious in about a week or two, especially in New York.
I want you to talk to us a little more, William, about what hotspots and areas you're watching of the country. And what's going on in New York. We'll pop up this map here. We just got it up to show where cases have been reported. And let's, of course, state the obvious, which is there are so many other cases out there where people have not been tested because there are not enough tests. So I'm sure you all have heard of cases. We've reported on them in the Washington Post. We've all heard of them personally, of people who have the symptoms. They maybe have a path of transmission even, but they haven't had the test. So these are cases that we know of. So what are you watching in New York? What's happened there? And where else are you watching?
Yeah, I mean, the kind of reporting out of New York from our team and others, I mean, it's pretty kind of shocking, grim. But one thing to keep in mind, even as you're seeing these hospitals run out of supplies, patients starting to overwhelm the hospitals, is that there's about a 2 to 3 week lag. So as bad as things seem now, there's a 2-3 week lag in terms of any kind of restrictions we put in New York. When the governor of New York ordered these restrictions and for everyone to stay at home and for business to close down, that was about a week ago, I think, when things started really shutting down. You're not going to see the effect of that for 2-3 weeks. So as bad as things are, we may see a really a huge surge for the next two weeks before things even start to maybe level off, or maybe even if it's still growing, kind of grow more slowly.
James, in your you write the Daily 202, you also have a daily morning podcast, and your morning podcast is pretty grim to listen to right now. And this morning you went, I think it was this morning, they're running together for me. You did detail like a lot of the really tragic stories, the horrific stories we've been hearing about deaths happening in New York, but also other places like Georgia. Do you think it's those stories that will wake people up who haven't been taking social distancing seriously or are confused by the mixed messaging coming out of the White House?
Yes, absolutely, 100%. And what I've been really struck by is how many people have sort of stepped up who have been victims of this to try to urge their neighbors to take this more seriously in red states that sort of lagged behind. A woman who lost her husband, who was in his late 30s, in Oklahoma, kind of pleading with her neighbors to take it seriously. Even, in Arizona, a woman who's in critical condition, who she and her husband, who passed away, tried to self-medicate, eating, fish treatment that they thought was, going to help. She was saying, listen to the medical experts. Don't listen to what you're reading on Twitter or seeing on TV. So I do think it's these person-to-person stories that do wake people up, and some of them. I mean, this job for, I think, all of us, especially William, who's spending all day talking to the frontline scientists. I mean, it's incredibly depressing, but it also is kind of a warning, because we still have it in our individual power to do something to flatten the curve, as painful and as hard as it is. But for the healthcare workers, Libby, it's been, those are some of the most painful stories. A woman who worked in a hospital in Georgia, as a mammogram technician. She died, and police went and did a welfare check. Her 4-year-old was there with her when she passed away. Another woman in New Orleans, her boyfriend came to check on her, and they had walked her dog. She seemed fine the day before. She had a cough. She died in her kitchen of the coronavirus before they could even get the test results back. So these stories are getting out there, and I think that they are kind of alerting people. The other one that I'll mention is, I think we've changed the narrative over the last couple of days about who's getting the coronavirus. I think if you look back at the conversation from 10 days ago, there really was this sense that it's old folks, it's the elderly, people 50s, 60s. But now we're hearing all these stories about people in their 20s and 30s. And the latest was in Kentucky, where a group of 20-somethings literally had a coronavirus party. Talk about tempting fate, where they all came together and were partying. Now, one of those 20-somethings has been diagnosed with the coronavirus. The governor in the bluegrass state, Andy Beshear, using that as sort of a cautionary tale to get young people to not have coronavirus parties and to start social distancing. And I think those stories wake people up when it affects you, when it's in your state. It doesn't feel like this is something happening in Wuhan, China. And so anyway, I think it's important to humanize this, and to, we look at that graphic on the screen there, and it's hard to fathom. 802 people is a lot of people. I mean, that's 3 plane crashes, and the numbers are going to go up every day. 55,000, as you note, not the full number. But, so I think when you see the number 55,000, it seems big. But then when you start telling even 5 of those 55,000 stories, you realize that, this is very real. And the other thing that I think it's important to understand is that this virus isn't discriminating. It doesn't, Prince Charles announced that he tested positive today. It doesn't matter whether you're rich or poor, whether you're a royal or a commoner, whether you're a man or a woman, whether you're a Republican or a Democrat, whether you're white or black. Everyone is susceptible. And so I think those stories also put that into stark relief for a lot of folks.
We have a question from someone who wrote in from San Diego, California. Bastian wrote in and asked about mobile field clinics. And he says, haven't towns and cities rolled out mobile field clinics, such like mobile operations that might be used in disasters, also telemedicine as a tool that can be used when we see a natural disaster take place. So William, update us on that aspect of things.
Yep, there's a lot being done. I think the governors especially, you're seeing a lot of leadership on the local level, on mayors and state level. So you have hospitals setting up kind of parking lot triage field hospitals. You have cities starting to look at stadiums, looking at high school gyms, any kind of resources they're setting up for the waves that are coming. I think there's 2 approaches that have been used abroad. In China, what they did is they set up these isolation wards. There's these huge stadiums that you just kind of put everyone who you suspect have the virus there and kind of isolate. And that's one approach that I think could potentially be coming. Another is, as you see the overwhelming patients coming to hospitals in Italy, what they did is they started setting up 2 streams of hospitals. One that is just for everyday, not everyday, I mean emergencies that are non-COVID-19, which is essential because you think about car crashes, even suicide attempts, you think about just everyday kind of heart attacks. You need a place to go that's not overwhelmed with patients. And then the other stream that's just with the coronavirus. That way there's less transmission and you're not risking healthcare workers as much.
I want to bring in one more question because William, I know you've been thinking about this and to be frank, we got a lot of healthcare questions and just like, what can I do to protect myself? So we'll bring on a doctor at some point to go through some more of those. And the Washington Post is constantly interviewing physicians and health experts and epidemiologists to answer these questions that are coming in because people are looking for ways to protect themselves. They're looking for home remedies and all sorts of things. But here's one question I think we can address as a group. And this comes from Mary in Arkansas. She asked about homemade masks. And we're seeing a lot about homemade masks as people around the nation come together and create them for healthcare workers. So she's asking about what kind of protection a homemade mask could offer from an illness when she has to go and leave her home to do things like get groceries or get medications.
That's a really good question. So on the homemade kind of front, CDC's issued some guidance to hospital workers that are helpful. Which essentially boils down to, if you run out of all masks, something is better than nothing. That said, the thing with these N95 masks, the reason they're so helpful is because of the seal that they put over your face. I wore these every day in China because of the pollution. You need to know how to fit them. You need to make sure that they're well fitted, and they have some reuse you can get out of them, but after a while, it does kind of wear out. So these homemade mask solutions are good. I think it's not clear how much they'll actually keep out the virus, but one thing that is very helpful is the psychological effect, meaning it is so hard not to touch your face. Like, we've all been like noticing how much we touch our face. But like, as I've been going out, one tip I got from our China reporters was that wear these gloves, wear these masks when you go out, because you're so not used to it that it kind of jars you out of the usual routine. And so you do notice when you touch your face as you're wearing these masks.
Great. I want to take a look at the world map to just see where activity is happening. We have, Washington Post just reported that we are hitting that 20,000 mark of reported deaths around the world. So this number has ticked up in just a short time. We turn this image around. James, what can we learn from other countries? Like, what are you watching? And we'll have William weigh in on this as well, but what are you watching in terms of how other countries have dealt with this?
Well, it's really striking because, yesterday India declared a national lockdown. Even during the depths of its crisis, China, where this originated, never imposed a national lockdown. They had major lockdowns of major cities, but they didn't do, and India has announced a 21-day lockdown. And this is coming against the backdrop, the president kind of wishfully thinking maybe Easter we could start to relax some of these restrictions. And so, I think watching what other countries are doing in terms of, Germany limiting no more than 2 people can gather, the UK also imposing kind of harsher and harsher restrictions. And, one of the things that's promising is that there are indications when you look at the charts that Italy's national quarantine is starting to work, that it's starting to bend the curve. And so they have some very restrictive rules in place in Italy. They're enforcing it. They're giving people criminal citations for violating the shelter in place orders, but they're bending the curve. And so, you look at the countries where it's been successful, they've been doing that. South Korea, is sort of a model. President Trump called the president of South Korea yesterday. So I think looking at the models that have worked is going to be really important as the experts try to persuade the president to kind of follow the science in the next week when his 14-day or 15-day kind of social isolation policy wraps up. Those case studies are going to be critical.
William, let's have you weigh in on this.
Yeah, there's two kind of tracks I talk about. One is method. One thing that really struck me as I've been studying some of these other countries is how far behind we are in the US. We just don't have the capacity. So say fighting a pandemic requires a whole tool belt. We have like maybe a hammer. When South Korea, they have like screwdrivers, ruler, everything. So this is is an example of what we're talking about. We're doing quarantining and isolation. That's like one tool, but you need many tools working at the same time. So South Korea, they're doing these things called large scale contact tracing. This is where you identify one person who has it, figure out everyone they've been in contact with, and then quarantine those people too. In Singapore, they're doing the same thing, contact tracing, but they're involving the police. They're using surveillance tapes. Anywhere this person used a credit card, they can kind of retrace the steps with enormous manpower. In US, the thing is that we can't do this kind of thing because health departments are in charge of this here, county health departments. If you look at kind of their budgets, like they're on a regular day, they're barely getting by. They don't have the manpower or resources to do it. So one thing we should be doing is scaling up these tools. I talked to one expert who was saying, we're at a deficit, but that doesn't mean we can't win. Like say contact tracing, there's that one tool. What you could do is mobilize a volunteer force. There's all these people sitting at home. There's no reason why they couldn't be trained and be helping with this effort. You could start hiring part-time workers. You could scale up, because this is a long-term thing. We're going to have to be acquiring tools to fight this. The other thing that I've really been thinking a lot about, and I don't know, I spent a long time in China as our correspondent there, and the cultural differences are really striking, and none is better than the other, but you're seeing the strengths of some cultures that really stress community well-being. The welfare of the greater is more important than the individual, kind of maybe more compliant, or with government, or in authoritarian governments having to do so by force. I don't think US is necessarily worse or better because of our cultural values, but I think a lot of our worser cultural values are coming out to play, while our better ones have not been put to use yet. Things like resilience, can-do-itness, this whole talk of like relaxing by Easter, rather than trusting that the American people have gotten through like World War II, we've gone through so much, the Great Depression, we should be tapping into that cultural resource as well, in the same way we're looking at expanding our tools.
Mm. Well, William, thank you so much. We're going to let you go. Really appreciate your time. James, stay with us for just a couple more minutes. This question of Americans tapping into their tools and the strengths that we do have is challenged if Americans aren't getting the right news, if they're not actually accessing their sources. Now, our viewers are obviously here watching. They're getting real news. They're hopefully reading the Washington Post and reading our articles. But there is this question of some of the conservative media taking a long time to get on board with the reality of the situation. And even this week, as President Trump has called for a focus on the economy, hoping that things might get back up and running by Easter, we saw very controversial moves by people like the Lieutenant Governor of Texas, who basically was calling on the elderly to put the economy before their own health and safety, essentially like calling on them to sacrifice themselves for their grandchildren or the national economy. So what are your thoughts on getting everybody on the same page to understanding the medical expertise and the medical advice on this?
Yeah, Libby, and that's a false choice, of course. We don't have to choose between our elderly and our economy. It is problematic. I think that some of the cable networks have made strides in sort of hearing from experts instead of just kind of the pundits. But a lot of Fox in particular has been very erratic. And it's hard to know, because I think that there's an interplay. I think sometimes President Trump is taking his cues from Fox, and sometimes Fox is taking its cues from Trump. So his big tweet Sunday night where he said, we can't let the cure be worse than the disease. That was verbatim what Steve Hilton had said, who's a host of like a Sunday night show on Fox, had said like an hour earlier. It seems likely the president was sort of reacting to that, got that idea in his head. And we know from reporting, Rupert Murdoch, who owns Fox News, has been taking extreme precautions for weeks. They canceled a birthday party several weeks ago because they were concerned about his age and the possibility of the coronavirus spreading. But meanwhile, on the network that he owns, the hosts were downplaying it, some calling it a hoax. And so then there was kind of a pivot led by Tucker Carlson to take it more seriously. Now they've kind of pivoted back. The reason, I think you hear from a lot of people, a lot of readers who are saying, well, what's wrong with the president sort of wishful thinking, aspirationally saying Easter, how great would it be to have Easter? The problem is a lot of people aren't paying super close attention, not the people watching right now, and they are taking their cues. They take their cues from the president, just like they take their cues when the governor of West Virginia says last week, go to Bob Evans and have a meal, or Devin Nunes says that. They listen to that because they respect those leaders. And so saying, yeah, like let's hope we can have packed churches on Easter, almost certainly Trump's going to end up walking that back. That's a totally untenable position to take. Every serious person agrees with that. But not everyone's going to hear sort of the clarification and the correction and the president's walk back. And so that is the danger. It's already hard enough to get people to make these sacrifices and to stay home. And it becomes all the harder when they're getting mixed messages and when they're not hearing directly from experts, or when people's partisan agendas are trumping the science.
Well, James, thank you so much for talking with us. Really appreciate your time. And at least you got a lot of books behind you to read.
Never a
You
shortage.
have extra time on your hands as you're stuck at home. Thanks for all your reporting, and we appreciate you joining us. I want to say thank you and goodbye to all the people who watched us. We're going to come back here on Friday at 3 o'clock Eastern time and talk about the latest headlines again. We'll update you on where the legislative package is at. We'll go over the latest, what's coming from the White House, and also what we're seeing in terms of cases around the country as well as around the world. So tune in on Friday. And I'll take this moment to ask you to subscribe to the Washington Post. You can hit the subscribe button if you're on YouTube, subscribe to our feed there as well, because it does support the journalism that we continue to do. I'm Libby Casey, and thank you so much for watching. Stay healthy and stay safe.